Welcome to the Mystery Symptom Summit, solving the root cause of your chronic illness. We are honored to have you join us. We have a few important items to share with you before we begin. First, all of our speakers have generously offered free gifts for you. Be sure to click on the link on the speaker page for their specific gift, and also visit pinkfortitude.com/Mystery Symptom Summit resources for all of our speakers' gifts, books, and even more resources you will want to check out. If you would like lifetime access to all of these interviews, plus additional bonuses, be sure to upgrade to our VIP membership package. The information provided on the Mystery Symptom Summit has not been evaluated by the Food and Drug Administration. The information is not meant to be used, nor should it be used to diagnose, treat, cure, or prevent any medical condition or disease. This summit is not intended as a substitute for the medical advice of a physician. The viewer should regularly consult a qualified, licensed doctor in matters relating to his or her health, and particularly with respect to any symptoms that may require diagnosis or medical attention. Neither Pink Fortitude LLC nor any of our speakers on the Mystery Symptom Summit are responsible for any specific health needs that may require medical supervision and are not liable for any damages or negative consequences from any treatment, action, application, or preparation to any person listening to or following the information on this summit. References are provided for informational purposes only and do not constitute endorsement of any websites or other sources. It is with great pleasure that I want to introduce our next speaker on the Mystery Symptom Summit. Let's welcome Dr. Evan Hirsch. Dr. Evan Hirsch suffered with chronic fatigue for 5 years before he achieved resolution using the Fix Your Fatigue program that he pioneered in his medical practice. Through his best-selling book, free Facebook group, and one-on-one coaching, he has helped thousands of people across the U.S. resolve their chronic fatigue. He is on a mission to help 100,000 more. He is board certified in family medicine and integrative medicine, and when he's not in the office, you can find him singing musicals and playing basketball with his family. We will be discussing the chronic fatigue mystery solved. In this interview, you will learn what are the causes of fatigue, how do you go about treating these causes, how infections and fatigue interact, and the path to healing. Dr. Evan Hirsch, welcome to the Mystery Symptom Summit. Thank you so much for being here.
Hey, Holly, thanks so much for having me on.
And can I just tell you why I'm thrilled to have Dr. Evan Hirsch on? First of all, his wife is going to be joining us as well as a guest. So make sure you listen to her interview as well. We've got an awesome husband and wife team. But here's why I invited the both of them on, is because they are my people, they are my tribe. They have suffered with chronic fatigue and came out on the other end healthy and to help other people heal. So that is why they are with us, and especially Dr. Evan Hirsch he wrote the book, literally wrote the book on fatigue. It's called Fix Your Fatigue. And we'll make sure we get you guys the links on Amazon. But yeah, this book is like dog-eared. Can I just tell you, I've read it twice. So make sure you buy his book. But I'm so excited to have him here today. And yeah, we are going to talk about chronic fatigue because it plagues so many of us. And when we talk about mystery symptoms, I mean, fatigue is fatigue and it's crushing, but it's like, where does it come from? Why does it exist? And how do we get rid of it? So that is what we are going to uncover today, and I'm so excited to get started. So thank you again for being here. So yeah, let's get right down to it. And before we start actually on my questions, you have such an amazing story. Can we just take a couple minutes and just share why we're even here?
Absolutely, Holly. So I was going through conventional medical school, and I had a lot of questions that couldn't be answered. I was getting more into holistic medicine and functional medicine and whatnot. And I came out west to Washington State and was doing my family medicine residency program, and I met my wife, Stacy, and she was vibrant and amazing. And, we had this great love affair. And 6 months later, her adrenals had crashed out. She was flatlined and she had a really hard time getting out of bed. And her chronic fatigue lasted for 3 years. And I'm going through residency program, and I am all excited and empowered to heal the world. And here's this person that I love, and I can't help her. You know, I'm just completely powerless.
And that has to be just soul crushing. I mean, especially, getting ready to be a doctor and yeah, not able to help your first patient.
Right. Yeah, it was devastating, and so, you know, I started on this path of helping people, of helping her, you know, get over fatigue. And it took, you know, there were some books out there, but there really wasn't anything that was able to address. And so I went to conferences and just studied and studied and studied. And this is, you know, after she had 3 years of chronic fatigue, then I got 5 years of chronic fatigue. And so I'm still studying and learning as much as I can, trying to apply it to me, apply it to her, apply it to all of my
So you
patients.
both got hit
Right.
at the same time.
Well, she was before me, and then as she was coming out, I was going into it.
Wow.
Yeah. And then yeah, and so then I'm, you know, I'm coming out of it, and I just have so much gratitude for having resolved it, figuring out those causes that took me so many years to research and fine tune all of my protocols that I've, you know, helped thousands of people in my practice. And now I'm on a mission to help 1 million people achieve the best energy of their lives. And so I've set up like a Facebook group, and I'm doing everything that I possibly can so no one has to suffer the way that me and my family have.
And you wrote the book.
Wrote the book.
Yes. Oh my goodness, that's awesome. So I mean, I know what it was like to go through. I can't even imagine just husband and wife and the spouse, like both kind of one after another. I can't even imagine, because I know how hard it is, or how hard it's been, on our marriage too and everything. I can't even imagine. So just
Right.
kudos to you, and thank you for being here and for sharing and, being so open.
Absolutely. Well, yeah, and I was going to say, you know, marriage is hard enough, but, you know, then to put fatigue on top of it, you know, and I have a lot of guilt and shame issues. So, you know, if I can't get out of bed and I can't help her because it's just, you know, I can only get to the office and see people for 4 hours a day before I have to crash, can't help out around the house. I feel really guilty and shame around that. You know, she asks for help and then I feel like she's attacking me. So, you know, there's a lot of stuff that we've worked through. And really interestingly is that, you know, there were some of the causes that were the same between the two of us. But one of the things we're going to talk about today is that everybody has different causes and everybody has multiple causes. So the causes that she had and the way that she was able to get over, you know, are very different than the causes that I had and the work that I had to do.
So let's actually, kind of start there. What are some, I mean, I know that it's numerous and too many to count, but what are some of the main causes that you see of chronic fatigue?
So I have found that there are 15 different causes, and those causes can really be grouped into deficiencies and excesses. And generally, the excesses will cause the deficiencies. So with excesses, we're talking about toxicity, we're talking about heavy metals, chemicals, molds, infections, allergies, negative emotions or emotional trauma, EMFs or electromagnetic frequencies, electromagnetic radiation, hidden dental cavitations or hidden dental infections, parasites. So those are all like the toxicities, those things that we want to remove out of the body. And then the deficiencies are things like deficiencies in sleep, deficiencies in hormones, adrenals, thyroid, sex hormones, deficiencies in water, so people who are dehydrated, deficiencies in nutrients like B vitamins, vitamin D, magnesium, deficiencies in exercise. So those are generally, and a lot of those things that are deficiencies in like hormones and nutrients, a lot of those are caused by a lot of these excesses that interfere with the individual biochemical pathways that don't allow people to function at their best.
So how do you know, I mean, how do you know what you're deficient or what you're excessing and what you're deficient in?
That's a great question. So that's the first step of the 4-step process that I talk about in the book, is to assess. And so a lot of that you can do with symptoms. You know, I can determine at somebody's first visit whether or not they have adrenal dysfunction or thyroid dysfunction or sex hormone dysfunction. But some of the ones that are more challenging that we really have to test for are molds, heavy metals, chemicals, infections, a lot of those can look very similar. They can cause neuropathy, so nerve pains, brain fog, muscle cramps. And so very important to assess those out. So I always recommend to people, and I tell them exactly how to do this in the book, how to assess by symptoms, how to assess by labs, how to get the labs without a doctor, and the exact protocols that they need. I basically just took all my protocols and dumped them in the book to help me with my mission here. But it's just really important to get that data so that you can determine exactly which causes you have. And so I recommend that as soon as possible, people do those labs early on. So when I do one-on-ones with people, I'll say, okay, so we're going to invest money up front here in order to be able to get all these labs done, so that 6 months or 12 months from now, we're not thinking, oh, well, maybe you have mold in your body. Let's get those labs done now, and let's get the right labs done so that we can get to the end faster.
So what was I say? So what are some of the so we talked about the causes. How do you go about treating?
So it's really individualized. So for this person over here who's got mold toxicity and heavy metals and adrenal fatigue, it's going to be different than this person over here who's got an infection like Bartonella and thyroid issues, which can be caused by Bartonella. So it really depends on the person, but after we assess, then the next step in the process is to replace the deficiencies. And so that's really replacing adrenals, thyroid, sex hormones, B12, vitamin D, iron, magnesium, basically hormones and nutrients, to get people feeling better, stronger, so that they're able to live their lives. They start to, get a breath of fresh air. Their energies kind of tick up a couple of points so that they're functioning better. And then they're stronger and they're better able to go after the toxicity. So then that's the next step. Oh, and I forgot detoxification. And then we start opening up the detoxification pathways, because with all of these excesses and these toxicities, the liver and the kidneys could be clogged, lymph, neural lymph, so basically lymph in the brain versus lymph in the body, skin, stool, these are all the pathways that we need to get the crap out of our body that generally get clogged up. So we start opening up those pathways, and then the last step is to remove the toxicities, the heavy metals, chemicals, molds, and infections. And I'm happy to go into more particulars about exactly how to do that if you'd like.
Yeah, absolutely.
So with heavy metals, I'll use a combination of herbs. I'm really a big fan of going big or going home. So I want to use something strong that works, but I also want to make sure that it's really safe. So 95% of everything that I do is natural. And so I use really strong herbs to get at the problem. And so I'll use herbs for detoxification, for binding, so I'll use products like charcoal and clays in order to bind up like moles, heavy metals, chemicals, and then glutathione, in addition to other herbs, milk thistle and whatnot, in order to open up the detoxification pathways. Because essentially, it's this push and pull effect where you have to make sure that the pathways are open in order to get the crap out. Crap is a very technical term, by the way.
That is a medical term, right?
It is a medical term, yeah. And so we want to bind up the crap, and then we have to make sure those pathways are open in order to get it out. So that's kind of the 1-2 with that when it comes to binding things, and then using things like glutathione and milk thistle and a number of other herbs in order to get things out. And then infections really have to be individualized. So, somebody comes to me and they've got big lymph nodes and they've got fatigue and they've got a history of mono, it's very possible that they have Epstein-Barr virus that we have to treat. So we want to use herbs that are very specific for going after the Epstein-Barr virus. If they have Bartonella, which is this bacteria that can cause a combination of headaches, neck pain, sleep problems, anxiety, depression, pain on the bottom of the foot, usually misdiagnosed as plantar fasciitis, and then cramping, usually in the calves. Sometimes they'll have what look like stretch marks on their body. They usually have thyroid issues or autoimmune thyroid, Hashimoto's, which I know you're very familiar with. And so all of those things, or a combination of like 3 or more of those things, generally will indicate that someone has Bartonella. And I actually have on my website a Bartonella quiz that people can take to determine if they have Bartonella. So if they have those symptoms, you have to go after those in order to be able to have resolution, and you need treatments that are specific. And those herbal complexes that I really like that are really strong are by a company called Byron White Formulas, which are really amazing, but unfortunately they're not available to everybody. You have to get them through a practitioner. And so, but they're wonderful and they're potent and they work incredibly well.
And let's talk about safety as well. I mean, obviously, the goal is for individuals to work with, you or a medical professional, obviously when they're kind of going through this. But let's talk about some safety issues with the detox, just things to kind of look out for in terms of, making sure those pathways are clear before you start pushing out. And the Herxheimer, I think is how it's pronounced, right?
Absolutely. So yeah, if you feel worse at all during this process, it means you're doing something too fast. So you really have to start opening up these pathways slowly. You have to start mobilizing. You're kind of pulling these things out of the organs, out of the tissues, and you have to have that balance where you're pulling it out as well as opening up those pathways. So if you feel worse, it means generally those pathways aren't open for detoxification, and you're pulling crap out and you're just re-exposing yourself. So sometimes if people are doing heavy metal protocols, you can pull heavy metals out of one part of the body and then it can go into another part. And if it goes into your brain, then you get more brain fog, and that's not something that you want. If it goes into the nerves, then you have more nerve pain, neuropathy. And that's why it's so important to work with a practitioner. And then when you go after infections, as you're killing these infections, they're releasing their crap into the body. And you will feel worse if you don't have those detoxification pathways open. And that's the Herxheimer effect, die-off reaction. It's known by a number of different terms. But you want to have that ratio of the amount of bug that you're killing and the amount that you're able to detoxify to be appropriate so that you can go through this process gracefully. And what I tell people is that this is a marathon, it's not a sprint.
Right, right. So yeah, thank you for that. Cause I know that, a lot of people hear detox and they start, with juicing and cleansing and, supplements. And it's just like, okay, take a step back, do it properly, do it right. So thank you for explaining that. So do you want to talk a little bit more about chronic fatigue and infections?
Absolutely. So we talked a little bit about Epstein-Barr. We talked a little bit about Bartonella. There's some other infections that I see quite frequently, Babesia, which actually it can cause shortness of breath, it can cause a cough. It usually causes spontaneous sweating. So in a woman who she's either premenopausal or she's postmenopausal, but she knows that it's not related to menopause, they'll just start sweating immediately. And it's because this Babesia organism looks and operates, it gets inside the cell and it looks and operates a lot like malaria. So you get like an instant fever and you start sweating, but very easy to treat when you have the right tools. Now, Babesia, Bartonella, and then Beryllium, which is the Lyme type organism that generally causes migratory arthralgias, or basically joint pain that kind of moves around the body. Those are all considered part of like Lyme type infections. And a lot of people a lot of Lyme literate doctors will go directly at Lyme, at Borrelia, when what they really need to be doing is going after the co-infections or these other ones that I've found play a much bigger role. Oftentimes when I get rid of Bartonella, Borrelia or Lyme goes away on its own. But if you go directly at the Borrelia, then you end up getting a lot of die-off. And like I said, I use very potent herbs. Don't use any antibiotics because the research shows that when you take antibiotics, as soon as you stop them, the symptoms come back. And antibiotics cause a lot more problems in the body than are worth it. It's really not worth the risk-benefit ratio. And then the last thing I'll say about infections is that most of us have all of these infections in our bodies from birth generally, but it's when you get a number of stressful hits that causes the immune system to no longer keep these infections in check. So let's say you have Epstein-Barr and Mycoplasma and Bartonella and stuff like that. Immune system's keeping all that stuff in check until you have a stressful breakup in high school, and then you go to college, or for me, it was med school and residency. Let's say you have a motor vehicle accident or an injury, divorce, whatever it is, those stressful hits, or mold or heavy metals or chemicals, those stressful hits take the immune system and take it over in this direction, and then the bugs come out and have a party, and they become opportunistic, and you get those symptoms. So reestablishing that balance, getting rid of the crap, is really what it's all about, and changing that immune system's relationship to those bugs.
And back to, you had talked briefly about the antibiotics. So the way that you treat with the herbs and the supplements, that's actually, and your protocol, that's kind of getting more to the root cause, where the antibiotics are just more treating the symptoms.
Well, the antibiotics can be treating the infections.
Okay.
It is definitely possible, but generally they're not getting deep enough. They're not addressing the biofilm, which is kind of the hiding place of the bugs. They're also damaging mitochondria, and they're, damaging, and they're changing your microflora. So basically the good bugs that are in your body. And so that's why I really like the herbs. And plus you have more control. And any time that somebody's having Herxheimer reaction, where you're killing off these bugs and the detoxification pathways aren't open, you're totally crashing your mitochondria, which is your energy center of every cell in the body. You're crashing your adrenal gland, which is responsible for everything from your get up and go to regulating blood sugars and the immune system. So it's just really important to go slow and steady, and I tell people, slow and steady wins the race. We want to be the tortoise and not the hare.
And the other thing too, I mean, this is, typically years or even a lifetime of buildup. So it's not going to, you're not going to wake up healed overnight. So, but
Exactly. I tell people it takes about 1 to 3 years for them to have complete resolution, depending on the number of causes that they have.
so I want to get into the kind of the healing aspect and everything like that. But I do have two more questions before we get to that. Neither of which we talked about, but I think you'll be okay with them. So the first one is, can you talk about food and chronic fatigue
Absolutely.
and how I
So,
guess it can either help you or hurt you?
yes. And so foods and food allergens, food toxicities kind of belong in the excess category. So generally, I tell people that the ideal diet for most people is meat and veggies. And that's because everything else can have toxicity associated with it. Well, and I would add in a little bit of fruit in there too. Meat and veggies, a little bit of fruit. But grains can feed yeast. They can feed lots of infections because they're very quickly converted to sugars. Sugars cause a lot of inflammation in the body. Gluten, every time we eat it, and that's wheat, every time we eat it, damages our intestines, causes inflammation, and oftentimes the inflammation will last in the body for up to 6 months from one bite of bread or pasta or whatever wheat thing that you're eating. So it's so incredible. If there's one thing that you learn, I'm talking about all this high-end stuff for people who have chronic fatigue, but if you're tired at all and you want one thing to make your life better, it's basically, getting rid of gluten. And if you can do meat and veggies, that's the next step, getting rid of grains. So that's huge. And people who are, I always tell everybody, like there's this big puzzle that we're taking care of all these issues. And right now, the food bit may not make the most significance in your symptoms, but it's a huge player. And so we really need that to be dialed in order to be able to have the most success with all the protocols that we do.
So, well, good. Thank you. And then the other one, you touched on it briefly when you initially, and then also when talking about your wife, Stacy, but can you talk a little bit more about adrenal fatigue and the HPA axis?
Absolutely. So the adrenal gland is a little small triangular gland that sits on top of the kidneys that's responsible for producing cortisol. So cortisol gets broken down into cortisone. Most of you have heard of cortisone shots at the orthopedic surgeons, or prednisone, which is used in autoimmune disorders. These are basically anti-inflammatory. So they decrease the amount of inflammation or fire that's in the body. And they all come from cortisol. Cortisol is our body's natural anti-inflammatory. And then it also does a lot of other things. So it manages stress. it regulates our blood sugars. It regulates the immune system. So anything that's stressful in the body, whether it's mental, emotional, like relationship or job, or physical, like heavy metal, chemical, mold, infection, injury, motor vehicle accident, any of these things that are stressful require that adrenal gland to put out more cortisol. And what ends up happening is that the more of those stressful things that you have, the adrenal gland can no longer keep up. And this beautiful curve that you're supposed to have, where you've got high adrenal function in the morning and then it kind of comes down throughout the day and then you go to bed, gets dysfunctional and it kind of looks like this, or it looks flatlined like it did with Stacy. So the adrenal gland is just, it's maxed, it's taxed, it can't manage the stress anymore. And that's why it's so important to remove all the crap, but also to support the adrenal. And one of my favorite things to use is eleuthero root. There's a product called Adrenal PX by Restorative Formulations, which is amazing. I've tried a lot of different adrenal products over the course of the last 10 years, and this is by far my favorite. And if there's one product for adrenal function that I can recommend to people, this is it. And a lot of people, they're like, well, do I have adrenal function? And it's, if you feel overwhelmed, if you have a hard time getting out of bed in the morning, if you crave salt or sweet, if you go from a sitting, lying down, or to a standing position and you get lightheaded, then that generally means that your blood pressure is not able to compensate from going from sitting to standing quickly, and that's an adrenal issue. So if you have any of those, then taking an adrenal product can be incredibly helpful for you.
And then you can also have the adrenal fatigue in conjunction with any of the other kind of fatigue drivers, right?
Absolutely. Yeah.
Okay.
Adrenal, when someone says my fatigue is caused by adrenal fatigue, it means there's something causing the adrenal fatigue. So it's definitely a symptom of the real cause, the real root cause. And it is one of those 15 that we talked about that needs to be remedied.
And the tired wired also kind of comes into play there too, right?
It definitely does. Yes.
That's my favorite. You're exhausted all day, you go to bed, and then you're like, I can't believe this is my life.
And the reason why that is, and I tell people, I say, I get more people to sleep at night by giving them things in the morning. It's because it's a circadian rhythm problem. So I give them adrenals in the morning, thyroid in the morning, B12 in the morning. All of those things end up increasing your energy in the morning so that it can come down throughout the day and then you can sleep at night. Otherwise, you're doing this. So if you're doing this during the day, you're doing it at night as well. And that's why at night you can't fall asleep, because you didn't have the energy during the day and the body's very confused about what sleep is and awake. It's like you're jet lagged.
Right. So, oh yeah, that's the worst. So let's get into some healing protocols. I mean, I know you touched, throughout everything we've talked about so far, but yeah, can you share some more of your healing protocols with us?
Absolutely. So is there anything in particular? I mean, in terms of replacement, we talked about adrenals, thyroid. Sometimes thyroid glandulars can work really well. Like I said, 95% of everything that I use is natural. The 5% that I prescribe as an MD is thyroid hormone, because the challenge really exists between getting the right dose of T4 and the right dose of T3, because people may try some of these thyroid glandulars, which are ground up thyroid hormone from different animals. And it's usually, it's not one size fits all. And so, this person over here may need a little bit more T4, which is levothyroxine. And this person over here may need a little bit more T3, which is liothyronine or Cytomel. And then sometimes you can combine that with either Nature-Throid or Armor or one of these complexes that has a little bit of T4 and a lot of T3, but it really is that fine tuning is incredibly important. So we talked about, and then the other thing is that with the adrenals and the thyroid, oftentimes they will be out of the body in about 3 or 4 hours. So with the Adrenal PX, I recommend that they take 1 to 2 capsules every 3 hours until 4 o'clock. And so that really supersizes that morning adrenal so that you can reset that circadian rhythm so that people can sleep well at night. And then with the thyroid, the T4 lasts about 8 to 12 hours, and the T3, the liothyronine, once again, has to be every 3 hours until about 4 o'clock. If you take things after 4 o'clock, generally they'll make your sleep worse. So that requires some of that nuancing.
Right.
Um, B12 in the mornings, generally 5,000 to 10,000 micrograms, depending on what people need. And then, like we talked about, heavy metals and chemicals and molds, you got to test. And then you've got to open up those pathways. You've got to use a good binder like activated charcoal or these clays or the Detox 1, Detox 2 products from Byron White formulas in order to get that crap out. And you've got to make sure you're not living in a toxic environment. So many people live in mold. 50% of all of the homes in this country have water damage, and most of those have mold. And
Wow.
so, yeah, it's so nebulous, it's so sinister, and it's so important. So if somebody's got sinus issues, if you got sick when you moved into a certain home, if you itch, if you've got itchy anus or itchy ears, if you've got fungal toes, oftentimes that can all be related to mold. And you have to test your environment and you have to get out in order to really achieve success.
And you had mentioned in your book as well with the mold that it doesn't, like, if you're the only person that's sick in your house, it doesn't mean that you don't have mold. I think I got that double negative right. Meaning, if you're the only person sick and no one else in your house is sick, you can still have mold, right?
Exactly. And so that's a great lead in. That section right there was called Why Husbands Don't Believe Their Wives When It Comes to Mold.
Yes.
And that's because genetically women are more susceptible. There can be men who, they've got really great detoxification pathways and they're like, I don't feel anything wrong with this home, but the woman is on the floor and can't get up, So it's really important that we believe our partners, we listen to them, and we make sure that we get help. And sometimes the symptoms are different for different people. For kids, sometimes it's behavioral issues. Sometimes it's the fact that they're craving sugar like crazy. And so because fungus craves sugar. And so there's all these different things that have to be teased out, but definitely, getting assessed, and you bring up a very good point.
So, and then also, how do you know if you can help someone with chronic fatigue?
So when people come to see me or when they're asking that very question, I, I ask them what they've had done before, because if they've tested and treated for heavy metals, chemicals, molds, infections, and they've had adequate treatment, they shouldn't have fatigue. But if they haven't, or if they've tested some of them but not all of them, that's when I know that I can really help them. And there's a whole gamut. Somebody might be an entrepreneur who wants to get their edge back because their energy is flagging, and they've got just a couple of causes. And then there's the person who can't get out of bed, who has more causes. So, I treat the gamut, but it's all because I'm on this mission to help people achieve the best energy of their lives.
And what are some questions that people can ask their doctors? So I know, especially with fatigue, a traditional doctor, well-meaning, but sometimes they're just, don't really know what to do. So, in terms of obviously your website, um, fixyourfatigue.org, wanted to make sure I got it right, has a wealth of information. But for individuals working with their own practitioner, what are some questions that they can ask, or what are some things that they can kind of say or do to help move that along with their own medical team?
So this has been really exciting. So I have a Facebook group. We have almost 900 people in there. It's a free group, and I do Facebook Lives in there just about every week. And people will tell me, I gave your book to my doctor, and they read it, and they said, okay, and they've started implementing things. There's the book. And so that just feels great. And unfortunately, there's a lot of ego in medicine, and so you just have to try to find a practitioner that's going to help and work with you. And I'm on a mission also to create an online course that can really walk people through this, so that it can be another nice complement to whatever they're getting from their primary care doctor. But there are some things in the book that they can ask, but it's really about what is the root cause. And if they're like, well, it's thyroid issue, well, what's the cause of the thyroid issue? And just keep asking why, with respectfully, of course, but keep asking why without um, making sure that you're getting at the root cause, because it's always 4 steps beyond what conventional medicine thinks it was. And this is a very different paradigm. I came from conventional medicine. I learned functional medicine, and then environmental medicine, and then specific trainings in infections and toxicity. So it's very different from where your conventional doc is coming. So you have to meet them where they're at, and hopefully they'll be willing to go on this journey with you. And a lot of the stuff that I recommend in the book, you can go ahead and you can do yourself as an adjunct to what you're doing with your conventional practitioner, and even your alternative or holistic, because there's not a lot of people that are specializing in fatigue, unfortunately.
Right. Oh, that's good. Thank you. So, and I want to make sure, is there anything else that we didn't touch on that you wanted to add? I just want to make sure you've got such a wealth of information. I just want to give you this opportunity to make sure that, we cover everything that you wanted to cover.
Well, one thing we didn't talk about was emotional trauma, which Stacy's going to talk more about. And that's really important. Retraining the limbic system, I have found to be very effective for people. So, there used to be this unfortunate thinking that fatigue is all in the head, that it's a mental condition, all that sort of stuff. And it's not, but there are big emotional players as part of this whole picture. So it is mental, it is emotional, it is physical, it is spiritual, and all of these things need to be addressed in order for people to achieve the best energy of their lives. So that would be the last thing that I would say.
And, it's interesting, just, kind of for my own journey, the first thing I did was give up gluten. I was like, okay, that's easy. Dairy's easy. So I got rid of the food triggers, cleaned up my toxins, did whatever. 8-year journey. And then we get to the emotions, and I was like, ooh, this one's hard, right? Like, I'd rather give up gluten any day than deal with emotions.
That's right.
So I'm glad we're going to deep dive with Stacy on that. So, but yeah, no, it is such, and I hate to say, like, it's just the piece that feels like everyone always forgets, or I think just wants to forget, right? It's the hardest one, I think, of everything, just because it's so personal and so deep and brings out so much that you just want to forget about. So
It's so painful. I tell people you have to wade through shit to come out clean on the other side. It's just, and that's from Shawshank Redemption. But yeah, it's so incredibly painful. I mean, me on my own journey and all the emotional processing that I've done, and the training and the coaching, and it's played just a huge role in my personal development and how I was able to get over my fatigue, and how I'm able to help other people. And yeah, I guess the last thing that I would also say is don't give up. If you don't feel well, if you have these mystery symptoms, don't give up. Just put one foot in front of the other. There's all these wonderful resources out there now. Get plugged into free Facebook groups like mine. Watch Holly Summit and some of these other summits that are out there. There's all this great information. Just keep learning, keep evolving, keep putting the pieces together, because you'll go and you'll see one practitioner and they may not have everything for you, but they may specialize in mold, and you'll get that mold piece taken care of. And then you go see someone who's a Lyme literate doctor who's able to help you in that realm, and then somebody who does detoxification. So you can piece all these things together and continuously improve until you get to the place you need to be.
And I'm really glad that you brought up that point, because and especially in the summit, I mean, we're touching on a lot of different information, and it's our bodies are complicated. Our chronic illness, our chronic fatigue, our mystery symptoms, I mean, it's complicated. It's not like, oh, it's just one thing and it's done. I mean, it's all interconnected. And it's that mindset of, I'm not going to give up. I'm going to keep searching for answers. And yeah, thank you so much for hitting home on that. So, and before we wrap up, I actually have one question for you. What is the one thing that you do, or kind of your one non-negotiable on every day that you do to maintain a healthy lifestyle?
So going through this process has definitely taught me how to take care of myself a lot better. So what's the one non-negotiable? That's a great question. I mean, I
Not
can
to
start
put you on
off.
the spot or anything.
No, it's great. There are several. I start off every day doing breath work and doing gratitudes. So gratitude practice, 3 things every day. and then I do visualizations. And then I eat really well. Our diet is really good at home. And then, really working on stress, working on my emotional self, drinking enough water, taking all of my supplements, getting to bed on time. That's a huge one. Stacy will be, she loves to process towards the evening, and I'm like, I love you and I want to listen, but I got to go to bed.
Aw.
You know? So it's really like 10:30 at the latest. So really, those are all the things that I found to really help me be as successful as possible. Yeah.
Oh, that's great. Thank you. So, and I want to make sure everyone knows where to find you. So we've got the link on our speaker page, but for those of you who are listening, and the link on the speaker page will take you directly. We actually you're offering the free PDF of your book. And this is a big book too. So you can buy the book on Amazon. We're going to have the link on our resources page. But if you want the PDF version, and again, this is a big book. This is like a huge, huge gift. So thank you so much for offering that. But you can go to fixyourfatigue.org, right?
Yes, fixyourfatigue.org. And don't be intimidated by the size of the book, because as I clarify in the introduction, if you've got brain fog or whatever, there is a summary and an action steps at the end of every single chapter. So if you just read that, you're going to get everything that you need to know in the chapter anyway. So yeah, if you go to the website, you can download the free PDF, you can join the free Facebook group and help me on my mission.
Yeah, and we'll put the Facebook group also on our resources page as well, and the PDF, and again the book on Amazon, and we'll have the link to that on our resources page as well. And yeah, no, like I said, I've read the book, and yeah, my brain's all over the place still. So it's getting better, but it's still all over the place. So the book is definitely it's packed full of information, but it's an easy read. So anyway,
Thank you, Holly.
yes, Dr. Evan Hirsch, thank you so much for being on the Mystery Symptom Summit. I'm just so eternally grateful to have you here and to share your knowledge on chronic fatigue with everyone. And yes, thank you so much for your time.
Thanks for having me on.
Thank you so much for joining the Mystery Symptoms Summit. And before you go, be sure to click on the link on the speaker page for their specific gift. And also visit pinkfortitude.com/mystery symptom summit resources for all of our speaker gifts, books, and even more resources you will want to check out. If you would like lifetime access to all of these interviews, plus additional bonuses, be sure to upgrade to our VIP membership package. The information provided on the Mystery Symptom Summit has not been evaluated by the Food and Drug Administration. The information is not meant to be used, nor should it be used to diagnose, treat, cure, or prevent any medical condition or disease. The summit is not intended as a substitute for the medical advice of a physician. The viewer should regularly consult a qualified licensed doctor in matters relating to his or her health, and particularly with respect to any symptoms that may require diagnosis or medical attention. Neither Pink Fortitude LLC nor any of our speakers on the Mystery Symptom Summit are responsible for any specific health needs that may require medical supervision, and are not liable for any damages or negative consequences from any treatment, action, application, or preparation to any person listening to or following the information on the summit. References are provided for informational purposes only and do not constitute the endorsement of any website or other resources.